third classification of joints, as far as the structure, is the synovial joint, and these by far are the most complex. They have an actual joint cavity, which is not the case for fibrous or cartilaginous joints. The bones are separated by a fluid-filled cavity with synovial fluid. Their classification functionally is the diarthrotic or freely movable, and it essentially includes all limb joints. So everything from the elbow to the wrist, to the knuckles, to the knee, to the ankle, to the joints between the toes as well. So there's lots of stuff going on here with synovial joints. They have 6 general features. They have lots of supporting structures because there's a high chance of injury to synovial joints. They have what are called bursa or tendon sheaths, which we'll talk about coming up. The stability is influenced by 3 different factors, and it allows several types of movements. So we can subclassify synovial joints into 6 different types, which we will be talking about coming up. The 6 different features are on this slide. The first one is that there is articular cartilage, remember, a type of hyaline cartilage covering the ends of long bones. The next one is a joint or synovial cavity. And this joint or synovial cavity is a fluid-filled potential space unique to the cavity. So what potential space means is that it's not always that large. It's going to increase in size based on the amount of synovial fluid that's present. It has an articular or a joint capsule, which has 2 layers. The outer layer is the fibrous layer, which is dense, irregular connective tissue, and an inner synovial membrane, which is the loose connective tissue that makes synovial fluid. And that synovial fluid is very important for lubrication of that joint. Synovial fluid is a viscous, it's a slippery filtrate because it's formed out of the blood. It's basically plasma and hyaluronic acid, and its job is to lubricate and nourish articular cartilage. You know, imagine lubricating the pistons of a car, for example, so they work better. It's the same idea. There's also lots of reinforcing ligaments because there's lots of chances for damage here. There's capsular ligaments, which are essentially within the capsule, and we're going to especially talk about those with respect to the knee, but there's also joints that are outside the capsule. And those joints are, or those ligaments outside the capsule, not joints, sorry, those ligaments are called extracapsular and then the intracapsular ones. Then there's nerves and blood vessels, nerves that detect pain, monitor joint position and stretch, and capillary beds that supply the filtrate with synovial fluid. The general structure of a synovial joint is shown on this slide. If we zoom in here, we can see lots of different stuff. We see the articular cartilage on the ends of long bones, the articular capsule, which has 2 membranes, the outer fibrous layer and the inner synovial membrane that secretes synovial fluid, the joint capsule or joint cavity, which is a potential space where synovial fluid is found. Then there's lots of different ligaments. There's ligaments inside the capsule and outside the capsule also. So some of those features include fatty pads, which are very strategically placed in areas where there's going to be a lot of stress on that joint. So they're for cushioning between the fibrous layer of the capsule and the synovial membrane or the bone. Then there's also articular discs, which in the knee are called menisci. These fibrocartilage discs are going to separate the articular surfaces to improve the fit of both ends, stabilize the joint, and reduce wear and tear. So for an athlete, when they talk about tearing a meniscus, this is exactly what they are referring to. The next supporting group of structures are called bursa and tendon sheaths. And both of these are basically bags of synovial fluid that lubricate the ball bearings. So they're not strictly part of the joints, but they're closely associated. So the bursa reduces friction where ligaments, muscles, skin, tendons, and bones rub together. And the tendon sheath is basically a bursa, but it's an elongated bursa wrapped around another tendon subjected to friction. So a really good analogy for the tendon sheath is to think about the hot dog bun that's around the hot dog. If the hot dog would be the tendon, the hot dog bun would be the tendon sheath. So we can see a tendon sheath there. We can also see various bursa that are also fluid-filled sacs. So when somebody has bursitis, that's inflammation of one of those bursa sacs. Our next slide is going to show factors that influence the stability of synovial joints. And there's three main factors that influence the stability of joints. The first of which is kind of the design of the joint or the shape of the articular surface. So what that essentially means is the more shallow the surface, the less stable it is as a ball and socket joint. And when we discuss these, we're going to talk about the two ball and socket joints. So we're going to consider the hip joint versus the shoulder joint. So you're going to make on your notes a small table, which basically has 3 columns and 2 to 3 rows. So the first row is going to be due to the articular surface or the joint design. So it would be corresponding to number 1 on this slide. So the second row that we're going to look at is related to ligaments. So the ligament number and the location. So the more ligaments we have, the stronger the joint. So you need to be able to compare and contrast the two ball and socket joints, the hip and the shoulder. So the second row that you're going to write down is the number of ligaments as well as the length of the ligaments. So we're going to look at the first row first, the articular surface. And for the hip, it has what's called the acetabulum. You've learned what the acetabulum is now. It's a deep cavity where the head of the femur fits. And it allows less rotation, or I'm sorry, range of motion. So ROM is shorthand for range of motion. So in physical therapy, for example, they'll use that shorthand as ROM. Contrasted with the shoulder obviously has a lot more range of motion, and that's because it has the glenoid cavity, also sometimes referred as the glenoid fossa. And when you look at the scapula, you've noticed that it is very shallow. compared to the acetabulum. So that means that there's going to be a greater ROM, range of motion. Then when we look at the ligaments, the hip is more stable, which I think we all know. Obviously, a pitcher has a lot of range of motion with their shoulder joint, and the hip is more stable because the ligaments are shorter. So there are shorter ligaments there that stabilize it, whereas the shoulder is less stable. And as far as the ligaments are concerned, the reason for that is there are longer ligaments. The last characteristic for influencing the stability of synovial joints is going to be muscle tone. Keeps tendons taut as they cross joints, and extremely important in reinforcing shoulder and knee joints and arches of the foot.